So in this video, I'm going to talk a little bit about medicine or medical type stuff that happened during the Civil War. On page 158 of the textbook, the paper copy you have, or page 8.12 if you're on the ebook, talks a little bit about medicine with this picture you can see here, and also on your ebook you can click through these pictures and look at some of the things, and there's hardtack that we talked about earlier. But first I would like to show you a video that talks about medicine and medical practices during the time of the Civil War. Enjoy.
When we think of Civil War medicine, we tend to think of some fairly common notions. We tend to think of relatively ignorant doctors hacking off the arms and legs of patients without really understanding why or really even needing to. We tend to have this idea that all of the Civil War hospitals were relatively filthy affairs, that they were dirty, that there was no understanding of sanitation. And we certainly think of people getting medications that by today's standards we just consider absolutely barbaric, things like lead or arsenic, which today we know are poisons. And because of that, I think we tend to have a skewed opinion of just how advanced or not advanced Civil War medicine was. And I think it helps to step back for a second and take a look at the reality and understand a couple of things about Civil War medicine. First of all, the conflict came about before we had what is now universally known as the germ theory. Most diseases were understood not to come from bacteria or from viruses as we know them today, but rather from bad air. If you almost think of it, things that floated in the air. Now we know that bacteria will do that, but back then they were thinking more gases or poisons in the air, and they actually call that miasms. So when you have the miasmic theory of medicine, we're not talking about giving you a pill that will kill the germ or stop the bacteria or stop the virus in your body. We're actually talking about counteracting a poison, so using one chemical to counteract something in the body that's doing something else. And because of this, we tend to have a fairly negative view of Civil War medicine. But let's take the most common thing that's out there. Most people, if you go into any crowd and you say, what's the number one thing you know about Civil War medicine, the hands immediately go up and they say, well, amputation was the most common surgery, and that's in fact true. Let's analyze for a minute why. The bullets in the Civil War by modern standards were enormous. They were greater than ½ an inch in diameter, and some of them weighed upwards close to an ounce. And when you're talking about an entire ounce or ½ an ounce or 3/4 of an ounce of solid lead, moving at 800 to 900 feet per second, and having that crash into a bone in your body, what happens is you have a tremendous amount of crushing power. And that crushing power translates into bones that are not simply broken, but rather they're shattered. Now in today's modern world, that's not a problem. We can put you into an x-ray machine, take a look at where all the broken pieces went, remove them from your body, and save your life. In the 19th century, however, there's so much dirt in the uniform that gets embedded into the wound, and there's no antibiotics to fight those infections. Infection is an immediate problem, and if we don't cut that arm or leg off, you're going to get an infection and it may well be fatal. Doctors knew this. The best possible way to save a life, the best possible way, was to amputate the limb, get as much blood flow as possible to that limb by cutting off a large portion of it, and by doing that, we're hopefully going to fight the infection or prevent it from happening and save the man's life. So amputation wasn't something done by ignorant doctors. It was something done by doctors who knew that it was the best possible way to save a life. It was also the quickest way, and that's important. If you have 100 men laying on the floor waiting for treatment, you could do an operation that takes longer that could save a life, but can the last guy wait that extra few minutes while you're doing the operation? Possibly not. So amputation not only saved the life of the man on the table, he also saved the life of the man who was waiting to get to the operating table. So when you think of Civil War medicine, don't just think of filth, don't just think of amputations, but think of other things. Think of the fact that those amputations saved lives. Think of the fact that, believe it or not, the hospitals were actually very sanitary, even by modern standards today. They were cleaned regularly. Understand that they invented a whole new dietetic system where diet was used, as we know today very well. Diet was used to help the body heal itself. So improvements in sanitation and diet, along with the operations that were done in the Civil War, not nearly as barbaric as you think. In the National Museum of Civil War Medicine, we talk quite often about the idea that Civil War medicine, it's not what you think. If you look at the reality, you'll find out it's a lot better than most people think. Civil War medicine was really a revolution that brought us to where we are today.
So that was a little video that talked about the Civil War medicine. So now I just want to show you some of the pictures, various pictures that I have from Civil War times. So this is standard stuff that a surgeon probably would have had during this time period. Now, these things right here, we've talked about these before, these lances. You learned about them last year in the Revolutionary War. They're actually used for bloodletting. They thought that by draining blood, you could actually help people feel better. Today, we know that is one of the worst things you can do, because if you lose blood, that can cause a lot of other problems for the body. And this thing right here is a thing that can actually help you probe for bullets. Try to find bullets and maybe dig them out if you need to. Here are just some other tools. These here, right here, are some other examples of bullet probes. If somebody gets shot, you can stick that in there and try to find the bullet. Some examples of canteens. This here is a tourniquet. You wrap it around an arm or leg or something like that, and you twist it really, really tight. And the thought is to cut off blood flow, especially if you have to amputate or remove the limb of somebody. And we know today that tourniquets are actually a really bad thing to use unless you absolutely necessarily have to try to stop somebody's bleeding. The best way to stop bleeding nowadays is to put pressure on the wound. These are just some other examples of tools that might have been used by a surgeon to try to dig things out. I'm not really an expert on medical times during the Civil War. I have a very basic knowledge. Just some more examples of bloodletting lancets here. And again, I couldn't tell you what all of these different things are, but here is a mortar and pestle thing where they can use that to mix different herbs, things together to create different medicines. Amputation did happen a lot. So here are just some different crutches that would have been used. This type of crutch on the left here would have been for somebody that maybe had their lower part of their leg amputated. So this could be like they're amputated at the knee. The knee could rest on there as a way to help them. Some different types of fake limbs were created during this time to help people. And here is a soldier that was, you can see by just looking at his foot, it was wounded and now it's starting to get infected. And the best way they thought to stop the infection was by amputation. They did have ways of putting people to sleep during this so they wouldn't feel it, but sometimes they would be wide awake. That is why this gentleman is being held down here. He is wide awake while this surgeon is preparing to amputate his foot. First thing they would have to do is cut through the tissuey part, the muscle and all of that, with a knife, and then they would get a bigger saw, bone saw, to help finish the job. You can see the water, very dirty and disgusting. They didn't take time to really clean their instruments when they went from one patient to the next. Maybe they take a wet rag, wipe off the blood, and use that saw on the next one. It's what they did. They didn't have a lot of time for sterilization. Plus, they didn't understand how important it is like we do today. Just some more surgical pieces, some scalpels next to bullets that were removed from patients during the Civil War. Just some different syringes, things like that to pull liquid or give shots. And then on the right there is a stethoscope, so they could listen to heart and lungs using this old-fashioned stethoscope. And if you've ever had a physical to doctor, they've probably used that on you. Here are just some other surgical instruments, knives for cutting through things. There's an example of a tourniquet. This is the bone saw, so that's the heavy-duty saw to finish the amputation. Just another example of a tourniquet. During the Civil War, the only combatants to be formally trained in first aid were sailors and Marines, so sailors are on ships. These men were taught how to apply tourniquets to save the lives of their comrades and would usually carry a tourniquet in their pocket during combat. Here's just a pocket surgical kits, various knives, scissors, scalpels, things like that in there that a surgeon might use. Just some more examples of surgical equipment. If you are a soldier that could be on horseback, you would have a saddlebag. So this would go over the horse, and you contain your medical supplies in there. Just another example of various scissors and tweezers, things they could use to pull things out if need be, especially bullets. Chloroform was a way to put people to sleep, especially by the Confederates. Chloroform is just a chemical that if you breathe it in, it will help you, go unconscious so they could do the surgery. And that's what they would do. This part would go in your nose, and then the chloroform would be put in there. You would breathe it in, and eventually you would, go to sleep, and they could perform the surgery on you. These contain an assortment of medicines. I couldn't tell you exactly what medicines are inside there, but an assortment of various medicines used during the Civil War. Vaccinator smallpox was a great concern to Confederate medical officers to prevent the spread of the disease. All soldiers who were admitted to the hospital were to be vaccinated before they were discharged. So smallpox is a disease, and they had vaccines back then, just like we do now. And this is just one way that soldiers were given that vaccination to prevent them from getting this disease. Here are some extracting forceps, and these could be used to help pull teeth. So you'd have dentists that could pull teeth, and that's what these would just grab on and yank out. This is a turnkey, a drill, and a file carrier. These are just other tools that would have been used by dentists during the Civil War time. And unlike the Union Medical Department, the Confederacy appointed dentists to serve in the general hospitals. The Confederate dentist wrote, a day's work consisted of from 20 to 30 fillings, the extraction of 15 or 20 teeth, and the removal of the tartar, so cleaning their teeth. So different tools that used by a dentist, very similar to some of the tools you'll see used by your dentist today. Just more dentistry tools. Good old cleaning of the teeth. Some more tools used by surgeons. I'm not going to show you a lot of these pictures because it's the same thing. So splints. So if somebody gets a wounded ankle or leg, they can use these splints to secure it and to keep from moving. So just like a splint we'd have nowadays. And I'm not going to go into a lot of details. Just some other ways medicine was sent and moved around. This is the reproduction of a leg bone. So you can see what could happen is when a bullet would hit it, it would shatter the leg. And they didn't have the ability to really repair this type of stuff. So that's why they would amputate, just because of the fact they could not repair legs or bone that was shattered like that. Here's another example of a bullet probe. Here is one way they could do it is get a bullet is they'd find it, they'd stick this device in there, and they'd drill it into the bullet, and then they'd pull it out that way. More tools. And here's another way of putting people to sleep. Is they would put this over their mouth and nose, and they put the chemical above it, and they'd breathe it in, and eventually they'd go unconscious, and you could do surgery. If you had time, it wasn't always they had a lot of time to do that, because if they have a lot of wounded soldiers, they don't have time to wait for the person to fall asleep. So a lot of times you're awake when this is happening. Just some other things here. You'd have wagon trains. So if there was a large battle, you would have trains like this that the wounded soldiers would be loaded onto these hospital wagons and brought back to the nearest hospital. And during this time, a lot of hospitals are made out of like school buildings, factory buildings, farms, any large space you could find is set up as a hospital. And here's just some other medicine bottles used during the war. So that's kind of where we will end. But after a battle was ended, going back to that, both sides would then go and collect their wounded, and they really wouldn't fight each other. They understood what they were doing there at that time. So both wounded and wounded, dead soldiers were removed from the battlefield following the end of a battle. If you have any questions about medical times during the Civil War, please let me know. Thanks for listening. Bye!